It was a crisp autumn morning in San Francisco, the kind where the fog rolls in off the bay like a gentle blanket, muffling the city's usual hustle. But for Jack Thompson, 72, that morning felt anything but gentle. He was in his small apartment in the Mission District, clutching his chest as a sharp pain radiated down his left arm. His vision blurred, and the room spun like he was on one of those old cable cars he'd ridden 1,000 times. This is it, he thought, fumbling for his phone. He'd always been the sturdy type, worked construction for 40 years, built homes for families across the Bay Area, raised 2 kids on his own after his wife left. But now, alone in that moment, he realized how fragile it all was. The paramedics arrived just in time. It was a minor heart attack, they said. "You're lucky, Mr. Thompson," the doctor at UCSF Medical Center told him later that day. "It could have been worse." Jack nodded, but as he lay in that sterile hospital bed, hooked up to monitors beeping like impatient metronomes, the real scare hit him. It wasn't the pain or the near miss with death, it was the aftermath. Recovery meant weeks of limited mobility, no driving, no lifting, no bending over without feeling like his chest might crack open again. His son, living across the country in New York with a demanding job and young family, offered to fly out. "Dad, I can stay for a week," he said over the phone. But Jack heard the hesitation, the mental calculation of missed workdays and childcare rearrangements. His daughter-in-law's voice in the background sounded strained. Jack didn't want to be that burden. "I'll manage," he replied, but deep down, he wondered how. Jack's story isn't unique. In fact, it's becoming the norm for millions of American seniors. According to a 2025 report from the National Institutes of Health, chronic health conditions affect over 80% of adults aged 65 and older in the U.S., with heart disease leading the pack. But the real crisis isn't just the illnesses themselves, it's the loss of independence that follows. A minor heart attack like Jack's can snowball into months of dependency, straining family relationships and eroding self-worth. The CDC estimates that 1 in 4 seniors experiences a significant health scare each year, and for many, it's the tipping point where living life turns into just getting by. Have you ever felt that vulnerability? That moment when your body betrays you and suddenly the people you love look at you with pity instead of pride? One viewer shared in the comments, "I'm 68 and after my stroke last year, my kids treated me like glass. I hated it. Had to rebuild myself to prove I wasn't done yet." Another wrote, "Health scares don't just hit your body, they hit your soul, but you can fight back." And that's the truth we're diving into today. Because when a health scare strikes at 70 or beyond, it's not about waiting for miracles or relying on others. It's about building habits that help you bounce back stronger on your own terms. Today, I'm sharing 5 habits that can transform recovery from a struggle into a comeback. These aren't quick fixes. They're lifelong practices rooted in real stories, backed by science and proven in the lives of everyday folks like Jack. If this hits home, drop your age in the comments and hit that like button. Let's get into it. The first habit: incorporate daily low-impact exercises to rebuild strength gradually. Jack started here, right in his hospital room. The physical therapist assigned to him was a no-nonsense woman named Maria who'd seen hundreds of cases like his. "Mr. Thompson," she said on day 2, "your heart is healing, but your muscles, they have been lounging too long. We start small." She had him do seated marches, lifting one knee at a time while sitting in a chair for just 5 minutes. It sounded ridiculous to Jack, a man who'd hauled steel beams in his prime, but by the end of that session, his legs burned, and he realized how much he'd let slip over the years. Back home, Jack committed to it. Every morning before his first cup of coffee, he'd sit in his worn armchair overlooking the street and do those marches, building up to 10 minutes, then 15. He added ankle circles and arm raises using the walls for support. "It wasn't about becoming a gym rat," Jack told me later. "It was about reminding my body it could still move." And science backs this up. A study from the American Heart Association, published in 2024, followed 1,500 seniors post-heart event and found that those who engaged in low-impact aerobic exercises for at least 150 minutes a week reduced their risk of recurrent issues by 25%. Why? Because these movements improve circulation, strengthen the heart muscle without overload, and boost endorphins that combat the depression that often follows a scare. But Jack's journey wasn't linear. There were days when fatigue hit like a fog, and he'd skip his routine only to feel worse the next day. That's when he learned the power of accountability. He downloaded a simple app on his phone, nothing fancy, just a tracker that pinged him at 7 a.m. with a reminder, "Time to move, Jack." He also shared his progress with a neighbor, an 80-year-old retired nurse named Evelyn who lived downstairs. They'd meet in the hallway sometimes, comparing notes. "If I can do my walks with arthritis, you can do your marches." This social nudge kept him going. Research from Johns Hopkins University shows that seniors who pair exercise with accountability, whether through apps or buddies, stick with it 40% longer than those going solo. As weeks turned to months, Jack expanded his routine. He ventured outside, walking the flat blocks around his apartment, starting with 1 and building to 3. The San Francisco hills were off limits at first, but he eyed them like old rivals. One day, he tackled a gentle incline, heart pounding but steady. "Felt like conquering Everest," he laughed. And it wasn't just physical. His mood lifted. The isolation that crept in during recovery faded as he greeted dog walkers and coffee shop owners along his route. A 2025 Mayo Clinic review highlighted how low-impact exercise reduces anxiety in post-scare patients by up to 30%, thanks to better sleep and reduced inflammation. Backing this is a wealth of data. The 2024 Dietary Guidelines for Americans, updated by the USDA, emphasize plant-based eating for seniors, noting that diets rich in omega-3s from fish and nuts cut heart disease risk by 20%. A long-term study from Harvard's T.H. Chan School of Public Health tracked 10,000 older adults and found those who increased fruit and vegetable intake post-health event had 35% fewer complications. Why? Nutrients like antioxidants fight inflammation, while fiber aids digestion and weight control, key for hearts under repair. But nutrition tweaks aren't just about what you eat, it's how you eat. Jack learned to mindfulness around meals, sitting at the table, no TV, chewing slowly. This helped him tune in to hunger cues, avoiding overeating that strained his recovering system. He also hydrated better, aiming for 8 glasses a day, often with lemon for flavor. "Water was my secret weapon," he said, "kept the headaches away and my skin looking less like old leather." A 2025 study in the Journal of Gerontology linked proper hydration in seniors to faster wound healing and better cognitive function during recovery. Challenges arose, of course. Grocery shopping on a fixed income meant budgeting smart, buying seasonal produce, frozen veggies for longevity, and generic brands. Jack joined a local co-op for discounts on fresh goods, turning it into a social outing. Viewer comment, 72 here, post-diabetes scare. Switch to Whole Foods, lost 20 pounds, feel 10 years younger. Start with 1 meal a day. Jack echoed that. Don't overhaul everything at once. One tweak at a time builds habits that stick. As his palate adjusted, Jack experimented, adding herbs like basil and garlic for flavor without salt. He even tried recipes from online senior forums, like a simple tuna salad with avocado. The result? Not only did his body heal faster, but he felt empowered. Food became medicine, he told me, and I didn't need a prescription. Habit 2 reminds us, your plate is your powerhouse. Audit 1 meal today. What small swap could make it heart-friendlier? The third habit, schedule regular checkups to catch issues early and adjust your plan. Jack had always been the tough-it-out type, skipping annual physicals because nothing hurt. But his heart scare was a wake-up call. Ignorance almost killed me, he reflected. Post-discharge, his doctor set him up with a quarterly check-in schedule. Blood pressure, cholesterol, EKGs, the works. At first, Jack grumbled about the co-pays and waiting rooms, but he stuck to it. His first follow-up revealed elevated blood sugar, a sneaky side effect of stress and meds.
Early detection meant lifestyle tweaks, not full-blown diabetes. That appointment saved me months of trouble, Jack said. According to the American College of Cardiology's 2025 guidelines, regular monitoring for seniors post-cardiac event reduces mortality by 28%, allowing for timely interventions like medication adjustments or referrals. But checkups go beyond the doctor's office. Jack incorporated self-monitoring, a home blood pressure cuff, weekly weight checks, and a journal for symptoms. It's like being your own detective, he explained. Apps helped track trends, alerting him to patterns, like how caffeine spiked his pressure. A study from the University of California, San Francisco, found that self-monitoring seniors adhered to treatment plans 50% better, leading to fewer ER visits. Jack also built a support network around checkups. He synced appointments with Evelyn's, turning them into coffee dates afterward to debrief. "Misery loves company, but so does progress," she joked. Viewer comment, 79. After my fall, monthly checkups kept me independent. Don't wait for pain, prevent it. Jack agreed. Regular checkups aren't a chore. They're insurance for your freedom. Expanding this habit, Jack explored preventive screenings, colonoscopies, bone density scans, tailored to his age. The NIH reports that proactive seniors avoid 40% of preventable hospitalizations. He even joined a free clinic program through his local senior center, easing financial strain. "Knowledge is power," Jack said, "and power keeps you in control." As he progressed, checkups became milestones. "BP down again," he'd text his son, sharing victories without needing help. This habit wove into his routine, reinforcing others. Exercise logs impressed his doctor, nutrition changes showed in labs. But midway through his recovery, a new challenge emerged, stress from isolation creeping back, affecting his readings. That's when habit 4 came into play.